safety information to you guys. Now, there are different kinds of medication errors which is based on the reference safety information. Um, First of all, the intended population. What is the intended population as an indication for that particular product which you are trying to develop or which is already there in the post-marketing surveillance or post-marketing cases. We call it as post-marketing cases. So these intended population is the indication. Suppose there is a product, metformin. Take an example of metformin, which is used for type 2 diabetes. Patients take metformin, but there is one more effect of metformin, which is weight loss. If any population or any person who is taking this metformin for weight loss, which is not the indication, that could be a medication error, and that is intended indication for what it is used. And if you are not taking it for the indication it is used, that can also become a medication error. Any kind of recommended dose, strength, for an example, common prescription, Tylenol. Tylenol for fever, 500 mg tablet orally every 12 hours for 5 days. So this is how it is prescribed. If Tylenol is not taken by the intended population, which is the general population, it is taken by some other population like pregnant women, or pregnant women Tylenol is also kind of prescribed, but extra strength Tylenol in children, something like that, the population it is not intended for. And moreover, if it is prescribed for not for fever or general body pain, it is prescribed for some other indication, muscle ache or something like that, so that could also be a medication error. Recommended dose and strength. Any medication should be given in certain strength to every individual based on the body weight, age, and everything else. But if any other dose or strength is taken which is not prescribed, that can also become a medication error. Any kind of other route of administration, how to take it. Suppose there is an injectable which is you are supposed to take it intramuscular, but you took it subcutaneously, that can also become medication error. Then recommended formulation. Certain medication you are supposed to take in tablet form, but you took it in a liquid form. So that can also become a medication error. Like you were not supposed to dissolve the tablet in water, but the patient by themselves dissolved it in the water and then took it. That can also become a medication error. Any kind of recommended frequency, like how frequently a drug should be taken. A drug should be taken like Tylenol twice in a day, but the patient is taking 4 times in a day or 5 times in a day. That can lead to medication error. Any kind of recommended duration of treatment, how long Tylenol should be given. It should be given 5 days, but the patient is taking for 10 days, 15 days. That can also become a medication error. So now you guys can have a little bit of concept as in what I'm talking about as medication errors. The pharmacist over here, they might know about medication errors. I'm pretty sure about it. But for the other people, it is important for you to understand the concept. And then there are different kinds of medication errors based on the drug procurement or HCP to the patient. As I have said, medication error can happen from the time it is manufactured till the time it is dispensed to the patient. So there are multiple steps where medication error can happen. It can happen during prescription. So the prescription error can be related to the correct dose, strength of the product, route of administration, the length of the treatment, instruction of dose titration, most appropriate dosing time if applicable for certain products. So these are certain examples for prescription medication